Hey, it's Jessica DeMassa with WTF Health. What's the future health? I'm talking to the who's who of health tech and healthcare innovation, and I'm doing it here at Artera's first ever customer event, Heartbeat. And joining me right now, I have Dan Dodson. He's the System Director for Digital Health and Innovation at UNC Health. Dan, it's great to have you here.
Hey, it's great to be here. I appreciate it.
All right, I got to pick your brain about all things tech, integration, and patient experience. And so talk to me a little bit about, how consumer technology is really setting a different benchmark for those of us here in healthcare. I mean, what are you seeing in terms of like our expectations as consumers trickle into how we act as patients in the health system?
I think that really over the last 3 years with the pandemic, that paradigm has changed so much. So people are now used to mobile apps and services. They can order their food, they can go to their vet, their dry cleaner. Healthcare needs to be at parity with that. So it's just a total mindset shifting to a consumer mindset versus just a patient, because we are all consumers as well as patients.
All right, so where do you decide to put tech? Like, how do you decide what gets some sort of digital innovation or digitization in the patient experience? I mean, how are you mindfully deciding at what places to put the stuff?
Yeah. It really depends on trying to make it a simpler process for the patient. It's about that patient experience. So we want to help the clinical side, we want to help our frontline providers, but the key thing is really just to make it easier and sort of behind the scenes. If it feels like you have to go download an extra thing, do another thing, and it creates work, then we're not doing our job. Our job is really to just make that seamless process much easier.
All right, where are you seeing good examples of tech integration in the patient experience process in a big health system like UNC Health? I mean, what's working?
Yeah, we find that like our one-stop shop. So we try to create the UNC Health mobile app, which is really an umbrella app that brings a lot of services under one application. It's really hard to get people to download an app. It's really hard to get people to use an app. So if you can put services that are relevant for them and sort of a great call to action that adds value, then we see a lot of value there. But it's really that patient engagement and just trying to bring information and self-service. People don't want to have to call somebody and schedule. They don't want to have to go through a lot of different IVRs and decision trees or phone things. They just want to get on their phone and be able to send a text and get something done.
Yeah, I feel like a lot of people don't even know they're being decision treed when it's happening to them. That's like that's when it works, right? Give me a good example. I want to kind of dig in on this a little bit. So it's like when you said, you want to make sure that the app is there and it's something that people will go to get like the value out of it, and it's like that's enticing for them. Right. What's been like the thing that has hooked people into the UNC Health app?
Well, we've incorporated wayfinding for one, which in wayfinding, if you're familiar with it, that's sort of like inside Google Maps inside the hospital. And when we have a large complex with a lot of hospitals that were started in 1954, it's a very mazy type of thing. And so those really help. But access to my chart, virtual care, schedule an appointment, find urgent cares, wait times. So it's really all of those types of things that bring it to what may be important to you may not be what drives me to that app.
No, that's cool though, but it is very experience-based, it sounds like, especially like the whole wait time wayfinding thing. It's like, the on-site experience improved. Tell me where you think tech is failing healthcare right now. Is there anything that's going on that you guys have implemented in effort to really improve the patient experience where now you're like, okay, this actually added more of an issue?
Yeah. Well, no tech fails, Jess. Okay, it's all for improvement. We all have improvements. Remote patient monitoring is an area that we've actually done pilots, and we found that it's a very fine line because there's a lot of technology. You're in the home. If somebody doesn't have the right connection, if they're not doing it correctly, if there's anything that sort of breaks, you don't have somebody right next to you to help solve it. Now, we've tried to really mitigate that, and there's some companies out there and partners who have really tried to streamline that process. But that's an area where you have to really get it right because it's important. You want to monitor that, but you don't want to put the burden onto that patient to really have to be the tech guru as well.
I love that, and it's really frustrating. It's like if you're trying to take care of your health and you can't get the tech to work, I mean, what's the level of you sticking with that and adhering to your care plan that involves that?
And adherence is really what's important, right? And so if I get frustrated and put it on the shelf after day one, then it really didn't do what it needed to do.
All right, I want to ask you a little bit about governance and what's going on, because this is one of the things that has been like a hot topic here at Heartbeat, is talking about, who's in charge of the patient experience and how do you integrate technology in. And so it sounds like there's a lot of players involved. So the experience design part of it might be owned by one group, like strategy or consumer engagement, but the actual IT implementation is owned by another group. And then you got somebody like you, digital health and innovation, just, throwing out ideas. Right. So how do you guys handle that at UNC Health? What's been your approach to managing the patient experience?
Yeah, it's definitely a collaborative effort. There are so many different players in it, and you do have a lot of governance groups, and depending upon the product, you may have to focus on a clinical governance or a technical governance or funding or whatever it is. But that's really what we're really, as we come together, that's sort of the goal, is to make that a process where we can get everybody on the same page. It's getting that mind share, getting people together. Within our organization, we really want to focus too on that underlying infrastructure. So not only governance, but how do we make sure our data is clean? How do we make sure we can get data from point A to point B? All the behind the scenes plumbing that you don't really see, but unless it's there, nothing else works, right? So that's what's important.
All right, cool. So talk to me about the future. All right, I need to know from you, how big of a deal do you think generative AI is going to be? How far away are we from this really? Like, okay, give us a reality check. In a big healthcare system that is really leading edge, we love to talk about these cool new technologies coming down the pike, but really, where are we at? I mean, we're talking about texting, that's good, but like really, how far are we, and what kind of a leap is that from texting to like the whole generative AI thing?
Yeah, so depending on who you read, it's going to save the world or destroy the world, right? So one of those two, somewhere in between. We're interested in it. I mean, there's guardrails you certainly need to put. We're not going to send any patient data up to the massive ChatGPT world, but we just announced that we are the next healthcare system to work with Microsoft and Epic on their integration with MyChart. So it's really to help the provider, facilitate answers back and things like that. So we're starting with a small controlled scale, and then we'll grow from there. But it is a powerful platform, and I mean, everybody's talked about it for the last, 6 months.
I know, like it's so
it is the only thing you can talk about anymore. So yeah, it's important.
All right, last thing for you. I have a big audience of startups that watch me, and you are the digital health guy at UNC Health, so you get pitched all the time. What's the one thing that you wish that these health tech startups knew that would make your job infinitely easier and get them to a yes a little bit faster?
Yeah, it's, they need to realize that many times the patient experience could be a 20-step process. And if you come in with a great point solution for step 3, that doesn't really help me in the overall experience. And also show the true value. So you can tell me that, it's the greatest thing in healthcare, but it's really great if you can validate that. We're looking for the value, especially with the economic, headwinds that we've all been facing. To be able to prove something out really helps us as we go through all those governance groups we just talked about. We have to prove it out as well. Yeah, we have to sell it internally as well.
Okay, so I have to ask the follow-up then on that. So what is the value that you're looking for? Is it necessarily ROI, or is it engagement? Like, how slippery are these metrics? Because it's like, prove the value, but okay.
And I get that a lot of times it's tough to show a hard ROI versus a soft ROI. But, a lot of things can make the patient experience better. But you really want to try to find some metric, some KPI, something that sort of helps show that what we were doing before is now better. And so, and it doesn't necessarily have to, show a 800% return, but it just needs to show that you are improving the experience.
Awesome. Well, Dan, thank you so much for stopping by and letting me pick your brain about patient experience. Thank you so much. So Dan's joining me here at Artera's Heartbeat event. I'm talking to the who's who of health tech about everything that's changing in healthcare innovation, and we're doing this special series on patient engagement, which you can catch on my YouTube channel. So head on over to youtube.com/WTF Health. Dan Dodson from UNC Health, thank you again for joining me. I'm Jessica DeMassa. Thanks so much for joining us. Bye.